Well, thank you very much, and good morning, everybody. I am delighted to have a chance to spend a little time with you today, and I know you have also some other outstanding speakers coming. Ben Nelson, who has been a friend and colleague for a long time, and shares some of the background that I have as a former governor and former insurance commissioner. I know is going to be with you, and Nora Super, who is putting together the very important White House Conference on Aging. I have had some experience with your profession and became first acquainted when I was elected insurance commissioner in 1994, and the actuaries in our department played a crucial role in helping us make important policy decisions about company rates, about balancing solvency with consumer protection, about forecasting into the future. And then as governor, I worked a lot with the actuaries on the state employee health insurance plan. It was a self-funded plan, so clearly looking into the future about, again, how to balance what we were charging individual state employees with what the trends were looking like in the future was always a difficult assignment, but made easier by having teams of folks who I could rely on. And then finally, as HHS secretary, clearly the actuaries both within the Centers for Medicaid and Medicare Services, but also who worked with me as one of the trustees for Medicare and Social Security, provided, again, critical input. And I know as we looked at the ACA, members of your academy provided, I think, amicus testimony at the Supreme Court level about issues like what the impact would be in the insurance market without an individual mandate, giving a very professional assessment of how that would impact the insurance industry into the future. So I just want to start with a thank you for the important work you do. The expertise that you bring to the table and your members bring to the table is really essential. But the most important piece of this puzzle is that the Affordable Care Act gives CMS the authority to test protocol through the Innovation Center tests and grants, to measure it with the actuaries saying this actually will lower costs and trends over time, and then take it to scale nationally. So there is a lot going on right now in health space, and at least I'm told by a lot of the providers that the amount of transformation in the health industry is more significant than anything that they've ever seen in their lifetimes, whether it's a provider looking at his or her own personal practice, or hospitals looking at ways to deliver care, or community health workers who are re-energized by the notion that we're really going to try to keep people healthier in the first place and align financial incentives with health and not just wait till we get to acute care. And I would say that data will inform a lot of the policy decisions going forward. And again, we'll end with where I started, where the work that you are able to do with not only an analysis of trends and issues, but looking and forecasting into the future will be more important than it's ever been, because we're on a new horizon. There is a new terrain here, and I think it will have a significant impact on not only government budgets, but certainly business profitability, personal budgets, and overall the health and well-being of the American population. So again, thank you for having me here today. I look forward to answering the questions that you might have for me, and thank you for the work you do each and every day.